Health with Mariposa.
Good evening to our viewers. This is our Facebook Live session. We love Nogales, specifically Talk Health with Mariposa. My name is Eladio Pereira. I'm the Chief Medical Officer at the Health Center. For those of you who have not joined us previously, a brief background. This is a session we've done now for several weeks. We'd like to bring topics and guests that are very practical to our patients and to other folks that are interested in their health. We hope this is practical and beneficial to all of you. Tonight I have a distinguished guest from Mariposa, one of our pharmacists, McCullough. But before we let him introduce himself, wanted to review with you our plan for tonight. We'd like to present to you for about 30 to 40 minutes on pharmacy issues related to medications, the importance of medication listing, medication reconciliation, maybe talk about a few medications, side effects for common conditions, and if we have time, discuss a very important concept that it's very important, the concept of deprescribing, which is a process of removing medications from the medication listing. We do have an ambitious agenda. We hope we can cover that or all of it. If we don't, that is okay. We'll come back some other time to review it. So I want to welcome Matt to our We Love Nogales Facebook Live. Matt, welcome to our session tonight. Tell us a little bit about you, what you do at Mariposa.
Well, thank you, Dr. Pereira, for having me. We're very honored to be here to represent pharmacy. As you mentioned, my name is Matt McCullough. I'm the pharmacy manager at Mariposa Community Health Center Pharmacy. I've had over 12 years of experience working with the Nogales community and different pharmacies around the community. And now it's my esteemed pleasure to be the manager at Mariposa. For those of you watching, just in case you didn't know, we actually have a standalone pharmacy at Mariposa main campus, which is located at 1852 Mastic Way. We are open Monday from 8:30 to 6, on Tuesday from 9 to 6, on Wednesday, Thursday, and Friday, 8:30 to 6, and we're now open on Saturdays from 9 to 2 to give the community an opportunity to come and pick up their medications.
Great. Well, thank you for that introduction about Mariposa Pharmacy. I know you do a great job to service our patients with prompt service. I know you have a few things you like to talk about our pharmacy, a couple of services we offer and we'd like to promote before we go into other areas. So Matt, go ahead.
Absolutely. So what makes Mariposa unique or special compared to the other pharmacies here in town? We have a lot of things to offer the community. For example, we have a medication disposal unit called MedSafe, where people in the community can turn in unused or expired medications, including controlled substances. Some of the pharmacists at Mariposa hablan español y pueden comunicar con la gente en un idioma que pueden entender o quieren hablar. In addition to that, we also have a new system called Liberty. And with that system, we have an awesome program called Meds on Q. And Meds on Q is actually a QR code that is on the testing label. And it looks kind of like this. I don't know if they'll be able to see it because it's kind of far away. But you can use a smartphone or a computer to scan the QR code, and at any moment, you can receive a consultation on your medication, giving you general information on what the medication is, what it's used for, and how to use it. That particular counsel can be amended to be in English or in Spanish, depending on the patient. You can also set up ready reminders as to when to take your medicine or when to pick it up. It's kind of unique to Mariposa.
The Liberty software, is that something we can go to the pharmacy, learn more about, sign up? Is there an app on the smartphone? How would you
So most modern phones, like iPhones, and I believe Galaxy will sometimes automatically pick up the QR code if you have that feature turned on.
Okay.
Or you can download an app called a QR reader.
Okay.
And you simply just scan it and just click the link, and it'll take you directly to the consult for that particular medication. As far as information regarding our system and what we offer, we're available 24/7. Well, not 24/7, but during normal business operations to come and ask about the pharmacy.
Okay. Let's talk a little bit about MedSafe. We frequently do not talk about stopping medication or disposing of medication.
Absolutely.
It is important to do that for many reasons. We don't want to keep medications that are not needed. Children can take the medications by an accident. Can you speak about the importance of disposing medications via MedSafe?
Absolutely. So the way MedSafe works is you just bring us your old bottles of medications that you're no longer taking or that have expired, and we dispose of those in a controlled manner. And the importance for doing that, one, you could have children or grandchildren in the house and you don't want them to have access to those kinds of medications, or it could be just something that you took and it didn't agree with you, and you shouldn't have it in the house anymore to avoid side effects with that medication. Other times it could be expired and you could forget and take something that could potentially no longer have an effect for you. Or it could even be something that is harmful if ingested by other people aside from yourself.
The safe is at the pharmacy.
Correct.
It's right there in the lobby. It's easily recognized.
It's easy to recognize. It's a big blue box.
Okay.
You just walk in, pull open the door, and pop in your
That's it.
medications.
That's it. That's great. You mentioned earlier about the importance of medication and counseling. You do some counseling in the pharmacy. This is an area of increasing importance to take medications the way it's supposed to be. There would be less side effects. It would be more efficient or efficacious. Can you talk a little bit about the counseling that you do and the importance of that face-to-face interaction between the pharmacies and the patient, and what do you do to make sure that we instill a sense of safety in our prescribing practices?
Yeah, so whenever you pick up a prescription, we offer counseling on every single medication that you have prescribed to you. At that point, a pharmacist would walk over and have a one-on-one with you to discuss what the medication is, what it looks like, how to take it, and common side effects for that particular medication. At that point, the pharmacist can also answer any questions you may have or any concerns. They can also look at your medical record, especially for those patients that are Mariposa patients, to see if you have any concerns, whether it interacts with any of the other medications you're taking.
And patients can come in at any time?
At any time, no appointment necessary. You don't even have to have a prescription dispensed from our pharmacy. It could be any pharmacy in the community. If you have a concern about your medication, we're there to answer those concerns. That's our primary goal, is to cuidar la gente, ayudarlos,
Right.
and para entender los medicamentos.
And in Mariposa, we are also moving to an area of something called a clinical pharmacy, which is really cool. Increasingly, pharmacists are linking with primary care doctors to provide better service. The knowledge base that's needed nowadays to practice medicine is so vast, and teams are best equipped to do that. A clinical pharmacist is a critical piece of that team in terms of looking at potential drug interactions, looking at the need to reconcile all medications and so on. And I think many of our patients will be seeing our clinical pharmacists more and more. We do some of that at the pharmacy, but many of our patients, we see a clinical pharmacist working side by side with the physician. This already happens in hospitals. We're adopting the same effort in our ambulatory care facility so that the pharmacist will help us with our patients to make sure they're taking the medication correctly and to make sure that if there are any side effects that we can identify that readily and bring it to the attention or to the attention of either the pharmacist or the primary care providers. And I think, Matt, you've been doing a little bit of work on that. I know we have other pharmacists involved with that.
That's correct. So we're actually lucky here at Mariposa. We recently, as you mentioned, are starting to develop a clinical pharmacy team headed by Gina Sablicki and Hia Ju. These two pharmacists actually work one-on-one with the doctors to help medications pass through insurance, especially medications that require a lot of lab work or history or special codes to get through. In addition to that, these pharmacists can work one-on-one with patients and review their entire medication profile, including things that they get at Mariposa, things they purchase in Mexico, over-the-counter medications, or medications from other pharmacies. This is extremely important in that by them reviewing these medications, they can catch potential duplication of medications, bad interactions between different drugs, things you may be potentially allergic to that you weren't aware of, things that are being prescribed by different doctors that are similar. It saves lives. It's very important.
Right. And I think our patients are going to be seeing more of that in the next few months. Let's move on to another topic that is really essential, and that's keeping an accurate medication listing. Es muy importante mantener una lista de todos los medicamentos que tomamos, por muchas razones. La dosis, la frecuencia, la razón, los nombres. ¿Puedes hablar un poquito acerca de la importancia de mantener una lista de medicinas apropiada y compartir esa lista con los médicos, el médico primario, los especialistas del farmacéutico, para evitar confusión, evitar problemas? ¿Puedes comentar un poquito acerca de la importancia de compartir esa lista, no tenerla en la casa nada más, y traerla con los médicos y el farmacéutico?
So, es muy importante tener una lista de los medicamentos que estás tomando por muchas razones. One reason being, it allows everybody to know what you're taking. That way you're not getting prescribed similar or redundant medications. Also, it allows people to prevent drug interactions from occurring, potentially life-threatening drug interactions. When we think of drug interactions, people think, oh, things that are prescribed, but that can also include things that you get over the counter. So the list should have everything that your doctors are prescribing you, things that you buy without a prescription at the store, or things that you can get in Mexico without a prescription. A lot of the times the names may be different, but the compound may be the same. So it's very important that you have that list. It's important because what happens if you can't tell us what you're taking? You're unconscious, an accident happens, God forbid, or a family member needs to talk for you. It's also very important to have this list so that way everybody who's treating you knows what you're taking. You could have one doctor at Mariposa, a specialist in Tucson, and another primary care somewhere else. It's very important that everybody knows what you're taking in order to prevent duplications, drug interactions. Same thing for the pharmacy. Luckily at Mariposa we have the health record for Mariposa patients, so it allows us to see what everybody at Mariposa and even some specialists are prescribing, but not everywhere has that. And having that list gives them a clearer picture of the entire patient.
It's important to underscore the fact that even over-the-counter medications must be reported. A typical one, for instance, would be ibuprofen, available over-the-counter. Ibuprofen can have significant interactions with other drugs, including blood thinners, such as warfarin. The fact that the medication is over-the-counter doesn't mean that it should not be reported. That also applies to herbal medication, even teas, and all of that. So I think you want to underscore the need to report all of it.
It's very important to include the things that you buy without a prescription. A lot of people think, oh, I can buy it over the counter, so it's not harmful. That's not always the case because at low dose it may not be, but combined with other medications or at higher dose, it can be. For example, Tylenol. You can be taking Tylenol that you buy over the counter and be getting a medication from the pharmacy that has Tylenol in it And you could be taking paracetamol from Mexico, which you may not have known is all very
It's the
same thing.
Absolutely. Matt, can you comment on the importance of taking medications as prescribed? We know that the pharmacology of drugs, it's difficult to remember, but it's really important to take as prescribed at the pharmacies. There are drugs that are best taken on an empty stomach, such as thyroid medications. There are other medications that are best taken with food or snack. So can you comment on the importance of taking medications as prescribed, empty, not empty, food, not food, and maybe give example or so of one of those?
Sure. As you mentioned, different medications require different ways to be taken in order to work. Some, if you take with food, can keep the medication from actually being absorbed. Other ones require food to be absorbed properly. For example, some antibiotics you shouldn't take with vitamins because the vitamins could keep the antibiotic from working the way it's supposed to. It's very important to take it as the doctor directed to prevent overdoses or underdoses. If you take it more than prescribed and don't communicate that with the provider or the pharmacist, who then in turn can communicate that to the provider, the doctor could think that the dose is not working for you and increase it. Or conversely, taking it not as prescribed or underdosing, they could think that they need to prescribe more and potentially overdose you that way.
Absolutely. For a long time, we have prescribed medications based on condition. We have medications to manage hypertension. We have medications to manage diabetes. We have medications to manage high cholesterol, coronary disease, etc. For the last several years, we've seen a change in our ability to prescribe effectively. And that ability depends on our genes. There's a new field out there. We're not going to spend a lot of time on this, but I just want to let the viewers know that the way we prescribe medications is going to change a lot in the future. There's a new field called pharmacogenomics, which has to do with the interaction of medications with our own genes. There are various terms for that. Precision medicine is one, which means that not far from now, we'll be able to prescribe medications based on your genome, the way you're born. Not just to document and expect efficacy, but to identify side effects. For example, I'll give you two examples, and I'll give Matt a moment to talk. There's a drug that we use to treat a viral infection called abacavir. There is a syndrome of a very severe hypersensitivity reaction called abacavir hypersensitivity reaction. We know that there is an HLA haplotype linked to that. If that HLA haplotype is present in the individual, the chance of an allergic reaction is extremely high. So now it is recommended that that blood test be done prior to prescription of that drug to prevent that from happening. The same applies to another drug called allopurinol. There's another HLA haplotype available. If done and positive, we don't want to prescribe allopurinol. The opposite is also true. There are some genes that are present that can help us decide which medications are going to be efficacious. We use that mostly in psychiatry. There is increasing evidence that some of the psychiatric drugs work better under certain situations related to gene. This is an exciting field. For a long time, we have been prescribing drugs just based on condition. Very soon, we're going to be able to prescribe a drug not just for the condition, for the gene makeup. And I think that's where the electronic health records will help us. We'll be able to link the gene or genome of each of us with the medication we prescribe. There will be an alert on the medical record that will help us decide whether that prescription is appropriate or not. So I think this is really exciting. I know for the pharmacists it's really cool because now we'll be able to deliver personalized medicine. And we're not far from that.
The future is bright when it comes to pharmacogenomics. As you mentioned, you'll be able to tailor the medication to the patient in order to keep the patient safe and therapeutic. This includes the aforementioned drugs that you talked about, but also the ability of a person to metabolize that drug and clear it from their system. Not everybody's the same. Some people do it slowly, other people do it really quickly, and the dose will need to be adjusted based off the type of metabolizer that you are.
Yes, absolutely.
So it's very exciting.
Absolutely. Let me move on to a couple of conditions that are very prevalent. Our patients are frequently confronted with these conditions. And we're not here to provide medical consultation, by the way. We're here to educate our patients so they can speak with their doctor about their conditions. The first one is high blood pressure, is hypertension. And more we realize that the management of hypertension is really critical to reduce the risk of strokes, heart attacks, and kidney failure. There are certain drugs that are utilized in the management of hypertension, and those drugs are chosen by your primary care doctor based on many factors, based on age, sometimes race is a factor, kidney function, etc. And I think our viewers can become familiar with those drugs. In the management of hypertension, we use a class of drug called the ACE inhibitors a lot. ACE inhibitors are medications that inhibit an enzyme that is used in the creation of a compound that is linked to hypertension. And the reason I mention those drugs is that they're very prevalent. We use them all the time. They're very effective. But they have a couple of side effects that I wanted to point out. The first one is cough, some of the ACE inhibitors. And by the way, the drugs that I'm talking about are typically referred to as ACE inhibitors, but specifically lisinopril is one, lisinopril is one, captopril is another one. Enalapril is another one. They tend to cause a cough that is typically dry. It's worse at night. It feels like a tickle in the throat, and it just won't go away. And that's something to keep in mind. And if they come to see us and they report that, we'll be able to change medication. That's the only treatment. But we want to stay within the class of either the ACE inhibitors or another class that is very similar called the ARBs, and we'll be able to switch that. There's a second side effect that I want Matt to comment. It's called angioedema, which is more serious. It's swelling of the mucosa of the lips, the eyelid. Can you talk a little bit about angioedema and the importance of reporting that to us right away?
Sure. So one of the rare side effects for ACE inhibitors includes swelling, more notably in the lips and in the tongue. It can occur relatively quickly, and it should be reported as an allergy to your provider. It could be life-threatening if it's affecting your ability to breathe, and it should be reported right away. If that does occur, usually a switch is done to, as you mentioned, an ARB or an ARB, because it typically doesn't have that same swelling. Or excuse me, it does still have that, correct?
Yes, that's correct. And the idea is that we want the side effects to be reported. And I mentioned the ACE inhibitor as an example. There are other drugs that carry side effects, and I want to make sure the viewers realize that it's really critical to report any of those things to either the provider or the pharmacist so we can make the change and document in the medical record that you have that, so another provider in the future doesn't prescribe the same drug.
So since we're talking about allergies, it's very important to tell that at all chains in the healthcare. So as you're going in for your appointment, filling out the introduction sheet, telling your provider and telling the pharmacist. That way everybody knows what you're allergic to keep you safe. Sometimes communication can lapse, and someone should know in order to save you.
It's also possible that an allergy could have occurred between office visits. So when the staff asked the patient, has anything changed? Is there anything new since the last visit? It's really important for the patient to report to us, this is what happened since the last visit. It could have been a visit to the emergency room, they were given medication, there was an allergic reaction, and we don't know about it unless we're told. So the idea is to report those side effects right away.
Your health is a conversation between you and your medical provider, and it's very important to let them know how you're feeling on a medication, and it's okay to ask, what is it for? Why am I taking this? How do I take it? It's also important to have that conversation on the back end with your pharmacist, so that way your pharmacist is aware of what you're allergic to, why you're taking something. This is truer when you don't have an electronic health record, but sometimes when you go to a store, the pharmacist may not know why the doctor is prescribing you something. They could have an educated guess, but it's one way to make sure that you're getting what you're supposed to be getting.
Yes. Great. Thank you, Matt. We'd like to move on to another topic. Our final topic today, this evening, is the concept of de-prescribing. This is a favorite topic of mine. Es el concepto de descontinuar medicinas. So for a long time, we have assumed that once we begin medications, they have to be taken for life. And there are times they need to. There are clearly indications for that. We see that in clinical medicine in different areas, from cardiology to rheumatology to other specialties. But there are some drugs increasingly that medical research has shown that at some point they should be discontinued for some time. A quick reminder that science evolves. Our knowledge base today is different than our knowledge base 5 years ago. We didn't know then what we know now. But once we know, it's important to take action on some of these drugs because they don't need to be taken for life. So we'll talk a little bit about that. One of the main reasons to see a primary care provider is to review the clinical condition, to review the medications, and how do we monitor both of them. A common question to the provider should be, is this a medication I need to continue? And there are some drugs that don't need to be continued indefinitely. The medical literature has been full of this for several years now. For example, drugs that belong to the class of proton pump inhibitors, to which omeprazole belongs to. We know now that once you treat the acute condition, whether that's an ulcer, whether it's an esophagitis, once that heals, we ought to consider other options for treatment. It doesn't mean that the drug can be stopped in all patients. What we're saying is that depending on the clinical condition, many patients can discontinue that. Now, we're not suggesting here that you go there and stop it, but rather that you have a conversation with your doctor. And let me emphasize that we're not recommending that any of these drugs we stop. What we're saying is that one of the office visits purposes is to review all your medications and ask the doctor whether this drug should be continued, what is the purpose of these drugs, and what are some of the side effects that can occur over long term. There are others. For example, Matt, you're very familiar with the non-steroidals, some of the side effects long term. Can you comment on the importance of, to some extent, limiting its use, or be careful about the use of ibuprofen, maybe as needed only versus repeatedly? And of course, the doctor will have the final say, but just a level of awareness with these drugs.
Sure. Things like NSAIDs or non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, the common ones that you'd find over the counter, are typically used in short bursts, not in all cases, but usually in short bursts with acute pain, acute inflammation states. Taking them long-term can sometimes increase our risk for cardiac events, cardiac problems, kidney problems. Not to mention, they are very hard on the stomach and can sometimes cause issues with gastritis, ulcers, if prolonged use. Not to mention, they do have blood thinning properties. Typically, once you start these, you use them, as I mentioned, in an acute scenario until you are feeling better and the pain is gone. It's not something you typically use indefinitely.
A good question for the doctor is, do I still need to take the ibuprofen? Is it time to back off and have it only as needed basis?
Absolutely.
Think that's
And that's where these clinical pharmacists can come in.
Yeah.
You can take all of your medicines and you can ask them to follow up with your provider directly if it's something that needs to be taken. They can review your medical records, your labs, and make recommendations to your doctor. But ultimately, it is up to the provider to discontinue a medication in a safe manner that won't result in more harm to the patient.
I want to finish our session tonight with prescribing in the elderly. That's an area of interest of mine. As we get older, we tend to be more sensitive to medications. We become more vulnerable. In some cases, our ability to tolerate medication is reduced. The kidney function is affected or reduced. Certain drugs accumulate. And we, the physicians, are very careful about prescribing medications in patients over 65. And you'll see physicians taking a more cautious approach to prescribing. There are drugs that we used to prescribe a long time ago that now we don't, or if we do, we're very careful. So one drug, for example, that we need to be very careful is a drug that we have used for a long time called Benadryl, or diphenhydramine is the generic name. Benadryl can cause sedation. It can cause problems with memory, ability to make decisions, problems with urine retention, and all of that. The idea of this comment is to be aware that as we get older, we just need to be more cautious of that. We're not saying that drugs can be prescribed. We do that all the time. But we need to take a step back at what are the drugs that we want to use, for how long, and what are the potential interactions. Would you want to expand on that, Matt?
Yeah, so as we advance in age, our bodies change, and our ability to process some of these medications changes. Some of them can impact older people's ability to focus, to become easily, some of them allow us to become easily confused. Some of them can impact our kidneys. Other ones can dry the mouth, cause urinary retention, blurred vision. As we advance in age, we're already at higher risk of falls. Taking these kind of medications can just increase that risk even further. And falling and breaking a hip is not something that you would want. It's painful, increases risk of mortality.
And as we get older, the patient should ask the provider, what are the side effects that this drug could have.
Absolutely.
Based on my age.
And that's one thing that our clinical team does. It reviews the medications for the elderly and reviews that against the Beers list to see if any could be removed or should be changed to something different.
Great. As we conclude our session tonight, I want to finish with a summary of what we've done tonight. We review our service at the Mariposa Pharmacy, the importance of disposing medications appropriately for MedSafe option that we have. Matt review our ability to provide refills and educate our staff using an app called QR,
Meds on Q.
MedRQ. As well, we discussed the importance of counsel and clinical pharmacy, medication listing, appropriate frequency and dosing, how to take medication appropriately. We discussed briefly a couple of medications that are very commonly prescribed, but they have some side effects occasionally. And we ended up talking about two areas of deep prescribing, the importance of reviewing or reassessing the need for medication at every office visit. And we ended up talking about a word of caution about prescriptions in the elderly, patients over 65. I think that's a pretty good summary for this evening. Le damos las gracias por haber compartido esta noche. Creo que tenemos una audiencia esta noche como de 300,000 personas en Facebook Live. Fue una noche muy productiva con Matt hablando de todas estas medicinas. Esto es un tópico favorito mío porque es muy importante no solamente recetar, sino recetar apropiadamente y que el paciente entienda lo que están recibiendo, los efectos secundarios, lo que pueden esperar. Le quiero dar las gracias a Matt por haber compartido conmigo esta noche, al equipo de producción de Marco y Edgardo, muchas gracias. Y nos vemos en 2 semanas. Hasta la vista. Good night, everyone. Thank you for watching Facebook Live. We love Nogales. Talk Health with Mariposa. Good night.
Talk Health with Mariposa.